Hello everybody. Today is our Wednesday, first of the month roundtable, and if you notice, we are in a different location. So we're trying to mix it up a little bit today because we're going to be going to equipment and talking about stuff today that's really, that Derek was dying to talk about, and it is about sweat. So this is our segment on hyperhidrosis. And for those of you that don't know what that is, that's excessive sweating for no good reason. You know, you're not exercising, you're not working out, but you're perspiring. And so a lot of people have this problem, and it can, you know, they don't really know the etiology, but people with anxiety can have it. There are different
medication-induced, caffeine-induced, a lot of things.
Lots of stuff. So we're going to talk about what we can do here at the Renaissance Center to address that situation.
Sweat concerns.
Yes. So I am going to introduce everybody first, and to my right, your left, this is Ronnie. Ronnie is our everything, our IT guy, our medical assistant, our, you know, you name it. He's chief scrub assistant, he's everything. Yes. And to my left, your right, is Marley, our physician assistant, and Derek, we have Derek here on the end. He's the caboose. It's weird because he's usually on this side of so I'm a little discombobulated here. But we had to cram in this little space because our seating area is a little bit different. So. But we like this cozy atmosphere, so we might be switching it up now that we don't have to be so distant. You know, in our waiting room, we can be together again.
This
so
is the CLC waiting room.
That's right. The Collini Laser Clinic where everything happens. So I'm going to actually turn this over to Derek first because this is his baby. He was dying to do this. Actually, we were supposed to do it last month, and I think that's when you were sick, maybe you had COVID.
So I missed. But hyperhidrosis is something that's very near and dear to me. I actually suffer from palmar hydrosis. A lot of people who know me know this. And there used to not really be many options for people. The only thing with sweaty hands, palmar hydrosis, which it can be sweat of the hands, the feet, the trunk, the face. Those are all very common areas that people suffer with this, and it is a hindrance to people's life. It's uncomfortable. They feel cold because their body's not actually hot, so it's just sweating uncontrollably for no reason. So the old treatments they used to have were like injecting Botox, which could be very expensive, and it's something that you have to consistently do, and you're kind of putting a lot of stuff in your body. So now they've come out with ways that we can go in with energies and actually kill the sweat glands of certain areas of the body. We haven't quite branched out to everywhere, but the Mirror Dry that we have can take care of the underarms, and then now we have the new Morpheus, which can take care of a lot of other areas of the body, to include the hands, feet, trunk, face, and it will go in and eliminate those sweat glands.
So Derek, can you explain to everybody how those, as he's perspiring,
it's
the lighting, it's
the light.
Can you explain to everyone how the lasers take care of that?
Could we do a field trip?
We can do a field trip.
All right.
And
touch them.
All right. So I'm not sure, Ronnie, this is you, or are you turning
I'm gonna go grab the camera, and then we could all just walk in.
Okay, perfect. We'll walk in. There we go. That's it. So field trip.
Field trip.
So here's one of our treatment rooms, and you can see how beautiful it is.
It's one of our treatment rooms, and this is the Mirror Dry machine. So this is a really exciting technology because, like I said, there was nothing that was non-invasive on the market for people to use. And this came out, I think it came out about 2016. I think you saw it in Canada, you said, and then you brought it to our attention. So all you do is you take this diode and you put, Marley will come in and numb you so that you're nice and comfortable. So it is a little bit more of a procedure than like just an average laser treatment.
And something about the numbing that we use. So this is a certain kind of disc that's going to administer the numbing, you know, in a pretty nice area, and it's going to be a little bit quicker. And these are super sharp needles, so they're not going to be as painful.
So
And they're
after
really tiny.
right, so after the numbing, you really are very comfortable, and Marley does the numbing for us. So this is a multi-personnel procedure, so you'll see quite a few people when you decide to do this.
Yeah.
So, as of right now, the Mirror Dry is only indicated for the underarms. There really aren't any off-label parts that you can do with it, and the reason being is when you take care of the underarm, this actually suctions onto the tissue, and you go along this little tattoo in increments, and that takes care of the entire axilla area. So what it does is it puts heat into the skin. That's going to kill the papilla, which is the bottom portion of the hair, the sweat, and the odor gland. So when you're getting the Mirror Dry treatment, you're not just treating your sweat, you're actually getting rid of 3 things in one treatment. The reductions that I see now that we've been doing this for a while are anywhere from 75 to 90%. I find that when someone has really, really severe sweating of the underarms, that it is a 2-treatment procedure. I have had a lot of people that have done it in one, and they're satisfied with the amount of sweat reduction that they've had, and also with the hair reduction that they've had. But I have a lot of male clients. I actually have a lot of police officers, so they're in those gray shirts all the time, and they would be really uncomfortable with the sweat of their underarm. And typically, guys, they do need a second treatment. But it's pretty minimally non-invasive. You're not cut, you're not raw after you get the treatment. You just feel really swollen. You feel like you have an altered sensation, kind of like everyone says, you feel like you have softballs underneath your arms. That resolves in a couple of days. You might be lumpy and bumpy, and it takes about 90 days for you to actually see the efficacy of that treatment. People see right away that they stop sweating, and then about a month it comes back, and then your body processes all of that, and after the 90 day we check you again and see if you need a second treatment. But another thing that we've gotten now is we did purchase the Morpheus 8. I'm just gonna scooch over here really quick.
I'll get out of your way.
Sorry.
We love this baby.
We love our, I'm sorry to stand in front of you, but we
That's all
love
right.
our new Morpheus. So
Morpheus takes center.
yeah, Morpheus takes the stage here. Let's put her here. So what we're able to do now with this is treat other areas of the body. So like I said, that uses suction. So if you're on an area of the body that the tissue can't be pulled up into, it's not going to work for that. It's also large. So now we can actually go into areas when people suffer with hyperhidrosis of the upper lip. We can go into the face. Trunk sweating can be treated. Axilla, if this is not something that you want to do, we can treat it with the Morpheus instead of doing the Mirror Dry. I would probably choose doing the Mirror Dry for the underarm, but any other area of the body we can do this. So what it does, it's able to go in with the 24 pin needles that it has. We're able to retract to different depths in the skin, and when those needles retract to those different depths, they actually let out a radio frequency energy, which is a heat-based energy that goes in, damages those sweat glands and papilla. You will get a tiny bit of hair reduction, but not the same as the Mirror Dry. You're actually really just going to see that sweat greatly reduce in that area. This is something that you would have to do multiple treatments of. And people will ask me, why do you have to do the multiple? In between the pins that we use, there's space to leave healthy tissue in between that. So it takes about 3 treatments to get full coverage of an area that you're reducing the sweat in. And we also have some other surgical options, I know, if people wanted to branch into that.
So I'm gonna talk about the surgery because I'm familiar with that, and then I'll let Marley talk about the Botox treatment too. So there is a surgical option that you can remove the sweat glands surgically. Believe it or not, I had that done. I was probably one of our first guinea pigs over 20 years ago, and it was probably one of the best surgeries I've ever had. This is a surgery actually very popular in Asia, in Japan and the Orient, because they wear a lot of silk, and a lot of perspiration can ruin clothes and hold onto odors and different things.
Silk and sweat's not good.
Yeah, silk and sweat's not good. So one of the things that I noticed, and this was about when I was around 40, I never really perspired before then, so I don't know what the trigger was for me personally. but I know I could get out of the shower, just freshly out of the shower, and put on a shirt and have a ring like down to here within minutes of coming out of the shower. And that was just, it was getting to the point where all I wore was black, ironically. And it, I was missing some of the other colors that I normally would wear. So it was preventing me from being me, in my opinion. So we decided that this is what we're going to do. It was a long procedure. It's not a hard procedure. It just takes a long time to do both arms, and you're surgically excising every single sweat gland. And it was a complete success. I mean, to this day, I don't perspire, which is great. And so, unfortunately, it is considered a cosmetic procedure, even though we know that this is a lot of medical conditions.
All of this is cosmetic.
We don't bill through insurance or do anything like that. It has just too many
it's hard
problems
to diagnose as well,
right.
and actually diagnose.
So
it
unfortunately,
medical.
this is something that patients do pay for. But if you're interested in that, that's really the ultimate in surgery. But since the mirror dry came, if you asked me whether I would go through surgery or do the mirror dry, I would have done the mirror dry now. It's much easier. It's a one and done. It's much quicker. But again, surgery is an option. Now, another treatment that many people see on the internet, or if they're researching, is Botox as a treatment. So because Marley is becoming our Botox queen here, we're going to let her talk about the Botox and the sweating.
Yeah, so with Botox only lasts about 4 to 6 months though, so you do have to get repeated injections. So that's just something to keep in mind, that is an option, but
it's an expensive option.
It is. It's probably the most expensive option because it's not permanent. It's something that you have to keep doing. So I would.
But that used to be it.
Yeah. When that was all we had, that worked well. Yeah.
Right. I was gonna say just another really important thing with the mirror dry is that I've had a lot of customers that were allergic to deodorants, and they were really trying to live a more non-chemical life. So that is something, being that it's not just the sweat glands that it rids you of, it also gets rid of the odor. People don't wear deodorant after they have this done. So that's like a phenomenal,
nice.
People are so happy to not have to do that anymore once they do get it. And I don't know if I mentioned with the Morpheus that we can actually treat palmar hydrosis with it, which is like that plagues my life.
Shake.
It plagues my life. I never want to shake a hand in my life. It's plagued me always. So that would be something that Marley would numb you for, because it would be you hear needles in the hands, that's a pretty uncomfortable treatment. But just to give you some relief, if you are someone that suffers with it, I know what you're going through, and we can at least get the palm reduced. The fingers are tough, because if you're like me, it kind of wraps all the way around the fingers. But we are always on the up and up to try and find the solution for this problem. I am obsessed with this problem. So we do have 2 options now, but anything else that comes along on the forefront, I belong to a society that is always giving information. So we really take this to heart. Hyperhidrosis is a really plaguing thing for people, and we have great options for everybody. Plus we understand it. So, yeah.
Right.
Come on in and let
Ronnie,
us
get
rid of that sweat.
Come back over here, because I don't think we're going to move again. I want everybody to be seen before we. Is there anything else that anybody would like to discuss before we sign off for the day?
Yeah, I don't think so. Just give us a call. And these procedures, even though they are laser treatments, they are actually procedures that can be done any time of the year. So we're working with the underarms here. You're not going to want to do heavy lifting or anything after you do that. And I'm sure if we do the palmar hydrosis with the Morpheus needling, you're going to be a little sore for a few days and have some altered sensation. So other than that, the downtime is extremely minimal. And this is something that you can do year round, like I said. So whether you're sweating in the winter like me or sweating in the summer, doesn't matter. We can take care of it.
They are really good treatments,
Yes.
and I think they're great options now. Ronnie, anything else?
Not today.
Marley?
Is there a special?
Oh,
For
we
the
gotta
marriage
have a
tribe.
special, yes. Thank you, Sarah. Sarah's
Yes.
our
Keeps us
producer
Yeah.
back here. She's our producer. She's making sure that we're
What was
staying on
that?
test. So normally a mirror dry treatment, and again, it's usually a one and done kind of procedure. Our routine price is $19.95. While we have this special going on through May, through Mother's Day, so it'll be for the next month and a half. The price is $1,700, so it's a really great deal. You remove sweat, you remove odor, and you remove hair all in one
And in a
treatment.
pretty simple,
Simple
in and out.
procedure,
You're in and
so-
out.
Yeah.
And just for comparison, not to keep going back to, but Botox would probably be what, around $1,200 a session.
Oh,
Yeah.
Easily.
Yeah.
So
Easy.
Botox
Even
injections, because
more,
people
probably.
when they hear the price of that will say, oh, that's 2,000 might be a little pricey for them. But if they go the Botox route, that could be 2,000 every 6 months.
Yeah.
You could be doing
Sooner.
that.
Yeah,
So,
even sooner.
Yeah.
By the time you're going through that, you could have had this done a few times.
and
so
for this you're numbed, and Botox you're not.
Yeah.
So it's pretty uncomfortable.
Yeah. Yeah.
So yeah.
Yeah, so I say stick with Botox for your wrinkles.
We'll treat
And
you
stick
sweat with
here,
this.
dry for your
So,
sweat.
yeah, stick down here for sweat. Yes,
That's right. That's right. All right, everybody. I guess that's it. Stay tuned for what we're going to be doing next month in May. I can't believe it. This weekend is Palm Sunday. The weekend after is Easter.
Yeah.
Before you know it, we'll have Mother's Day. And we have all this stuff coming up. So we'll be keeping you posted about all of our specials, all of our information. And of course, as we get closer to summer now, we're really going to be talking about summer ready, probably in May. So that's what our
And
topic
one
is.
other
Keep you
thing
dry.
is Botox with Marley.
Oh,
on
and right.
Wednesdays.
Right, we
Yeah.
now have Botox with Marley, and I have to say, Dr. Collini has imparted his great technique to Marley, and she's a fantastic, I don't want to say she retrieves it well. She understands it. She does it. She does exactly. Not everybody can do it. It is a special technique.
Marley's
And
been
she's
doing
great at-
mine, and I love it.
She's done all of the staff, and she's
Yeah.
branching out into the customers, our young audience. She is awesome, and so for April, May, and June, we have Botox with Marley for $11 a unit. If you know what Botox costs a unit, that's a
fantastic.
fantastic price.
Really good.
So come see Marley. You will love her, and as we all do, and keep smiling, keep those wrinkles down, and stop sweating.
Yes.
That's it. So until next time, everyone, take care and have a great month. Bye now.
Bye.